let's talk about African Americans, though, because when you look at the stats, those are very different stats than others.
Exactly. So African Americans have a 20% higher incidence of developing colon cancer.
But why? I mean, 20% is big.
Well, there are fewer people getting screened, and African Americans have a younger age of onset compared to other ethnic groups. And when they're diagnosed at an earlier age and a later stage. And so, unfortunately, they have a worse survival rate.
So when should someone first have their colonoscopy? What are those guidelines and where are they coming from?
The recommendations are by the United States Multi Society Task Force. Okay. And they state that, first of all, if you have a family history of colon cancer, in a first degree relative, so that means either a sibling or parent, then you should begin your colonoscopies at age 40 or 10 years younger than the age that that person was diagnosed. So, for instance, with Chadwick Boseman, he was diagnosed at age 39. So, his first degree relatives should begin having their colonoscopies at age 29. Okay. What's also clear is that all African Americans should start getting their colonoscopies at age 45. Non African Americans, according to the United States Multi Society Task Force, should start getting their colonoscopies at age 50.
So let's talk about quickly, what are some of the risk factors for colon cancer that people should know about?
Aside from a family history, pretty much just unhealthy living. So, obesity, smoking, heavy alcohol use, sedentary lifestyle, a high fat, low fiber diet.
And what are some of the symptoms that people should look out for that may give them an indication that they could be suffering from it in an early stage?
Rectal bleeding, anemia, weight loss, unexplained weight loss, a change in your bowel habits. So going from diarrhea to constipation or constipation to diarrhea, abdominal pain, and just extreme fatigue and weakness.
But Dr. Gordon, not everyone has symptoms. Sometimes you can be symptomless and still have it.
Absolutely. So you do not want to wait for symptoms to develop to start getting screened. As a matter of fact, by the time you have symptoms, you're usually at a later stage. So definitely start getting your colonoscopies at the current recommendations.
Now, in your practice, give me three of the top questions you're asked on a daily basis.
I would say probably the most common one is, does it hurt? And no, it does not, because you're put to sleep, so you don't feel or remember anything at all. The second question would probably be about the colon prep. So there are different formulas that are available. There are large volume, small volume. There are pills that are available as well. So you just want to speak with your gastroenterologist to determine which product works best for you. The third question would be, how are they going to feel after the procedure's been done? Most people feel actually great. Some will feel groggy, so you can't go to work that day, nor should you drive. But the following day, you can go back to your activities of daily living and your normal routine.
Dr. Gordon, thank you so much for such great information. Hopefully people will take it. It'll save lives and get people into the doctor's office. Thanks a lot.
Thank you.